Hi, I'm Dr. Thad Deal and I'm a board-certified chiropractor. In our office, we focus on chronic, difficult-to-treat conditions like peripheral neuropathy. If you've suffered with neuropathy for any length of time, you know how frustrating and debilitating it can be. You may have been even diagnosed with something called idiopathic neuropathy, which simply means that your nerves are sick or damaged and we don't have any idea why. The reason we don't know why is because no one's ever taken the time to look. And the reason for that is because it's not going to change your treatment. You're likely going to be given gabapentin or Lyrica or some other medication to help mask or cover up the symptoms. Now this may help somewhat or it may help for a little while, but it's not actually doing anything to correct the cause of your problem. And again, that's because no one's taken the time to look for it. In our office we do. And what we find are 5 contributing factors or causes. Number 1 being blood sugar. Now most people understand that people with diabetes can develop peripheral neuropathies, but what a lot of people don't understand is you don't have to be diabetic to have a problem with blood sugar. You can be insulin resistant or have something called metabolic syndrome. You may even just be dysglycemic, meaning that your blood sugar varies wildly. The second thing that we look at is autoimmune, secondary to food sensitivities. We're not ever going to know whether this is occurring unless we check for this. But this is not nearly as uncommon as you would think. The third cause or contributing factor we see in our office are statin medications or cholesterol lowering drugs. Now I'm not here to tell you to stop taking any medications. That's between you and the doctor that prescribed that drug to you, but you do need to understand that there are side effects and there are some things that we can do to help mitigate those side effects. The fourth cause we need to look for are toxins, exposure to things like chemotherapy, heavy metals. We need to look for and remove or minimize the effects that they're having on your nervous system. And last but not least is an area of the brain called the parietal lobe that's responsible for processing sensory information. And if the signals reaching the parietal lobe are distorted in any way, it's like when the radio dial in your car is just a little bit off, the station comes in fuzzy. And we're going to get symptoms of numbness, tingling, burning. So we need to do a good neurological evaluation to see whether or not you have any neurological aspects to your peripheral neuropathy. And we need to check for all these things all at once because in all honesty, it's likely a combination of several of these things. Once we find out what's causing your peripheral neuropathy, we can design a custom program of all natural therapies, dietary, lifestyle advice, and specific supplementation based off of lab work that we do in the office to help correct the problem. If you're interested in learning more about our approach or you'd like to schedule an initial visit, please fill out the box on this page or call our office.